Well, happy quarantine, everyone. Thank you for coming to listen to us today. Me and Quint and Chloe are going to be talking about how the pandemic has affected our lifestyle as IBD patients. So something we talked about a lot that I just wanted to mention before we begin is that a lot of us patients with IBD and other patients in general have experience already with isolation. So this means a lot of us already have ideas of some coping mechanisms, and we already have a little bit of experience with this. But that doesn't necessarily mean that it's easier, just that we kind of know how it works. But that's just something that we've been talking about in the PAC somewhat. So I just thought that was interesting to mention. So then our disclaimer, we are not giving any medical advice, but just our own patient perspectives. So just wanted to mention that. So next slide. So these are just a few ways. We've had a lot of discussion in the PAC over the past few weeks about how COVID has affected IBD patients. Of course, there's the mental health impacts of isolation, depression, anxiety, and stress. There's been some discussion about how hoarding and the mass consumption of food and resources has limited access to those. Of course, telemedicine has gotten a lot more common now, so that has been a huge jump for everyone, including IBD patients. And then there's also been some complications with treatment. And this isn't necessarily access to medication, but more of changing surgery procedures. Those are getting pushed off. It's much more difficult to get testing and whatnot. And then we're also going to talk a little bit about coping mechanisms that we find useful and that we think might be helpful to other patients. So next slide. Thank you. So basically what we're going to do is we're each going to just talk a few minutes to give a little bit of overview of how this pandemic has affected us personally. So to start off, my name is Becky Woolf. I was diagnosed with Crohn's at age 7. I'm 18 now, and I'm a high school senior. So of course, that means I'm not graduating or going to prom or having college orientation. So that's just a few ways that my life has been completely upended by this virus. But from an IBD perspective, it's also had a lot of impacts as well. Social distancing is really important for everyone, but as an IBD patient, I'm immunocompromised and vulnerable. So it's also even more important to me that everyone else is staying safe because I have a vested interest in that. So I was joking to some of my friends about it, but I've been getting a lot of invitations from people my age to go hang out, even though we're under quarantine. So it's kind of concerning in that way because although a lot of people are social distancing and really doing it in a really amazing way, there's still a good number of people who aren't. And that's really scary because it only works if we're all doing it. So that's just something we've been talking about a lot that I wanted to bring up. And then also personally for treatment challenges, so I have a diverting ileostomy, which was placed like around 3 years ago. Actually, my ostomy anniversary is coming up next month. So very exciting. Yeah, so I was looking to getting that ostomy reversed for college, so I wouldn't have to burden my roommate with that. But because of this pandemic, that surgery is probably not going to be able to happen. The hospitals aren't safe and they're much more preoccupied with critical patients right now. So that means I'm going to college with an ostomy when I was hoping not to. So that's pretty much the main way that my treatment has been affected. And then for me, the diet thing has also been very interesting. As an IBD patient during quarantine, I'm also Jewish, so I had Passover as an IBD patient during quarantine, which meant I was eating exclusively eggs and matzah for a week. Yeah, so I mean, with all of this shopping, people are hoarding all this food, gathering stuff, mass consumption. It's really hard to get access to those foods that people need. I know there's a lot of IBD patients who are on really specific diets and having trouble actually getting access to those foods that they need because they're not there because everyone's hoarding them. So that's definitely something to keep in mind, that although we do want to have limited exposure to grocery stores, it's also really difficult for people with very severe dietary restrictions to be able to get the food they can actually eat. And then, of course, my mental health has been impacted. The isolation has brought up a lot of memories of when I was stuck in the hospital. I actually, for 2 days during my first hospitalization, I was labeled as an infectious disease patient, even though it was just Crohn's. So they walked in with their full gear on. So kind of a throwback to that. But yeah, I mean, everything getting canceled and kind of doing a 180 has been very crazy for mental health for a lot of people. So coping mechanisms that I've personally used is staying in touch with people. It's really, I'm on Zoom or talking with my friends at least once a day. Um, I've enrolled in some online classes to stay busy. Exercising is a big thing, and definitely spending time with family. I'll pull away from them a good amount so I don't blow up at anyone. Definitely important to manage that. But I've also found that really getting to spend time with family in a nice way is very relaxing and a big pro of this situation. Of course, I mean, the pandemic is a very unfortunate situation that we're in, but I think a lot of this is really finding like what kind of works for you to cope and trying to find the positives in it.
Okay, hi everyone. My name is Quint Townsend. I'm 22. I'm a senior currently at Clark University out in Worcester, Massachusetts. So similar to Becky, the whole graduation thing is kind of not put on hold, but definitely changed a lot. I know at least for us, we're getting I believe it's a 45-minute live streamed event where we're having multiple people talk, but obviously it's not the same as gathering together with all your friends and having all your family come to these events. So that's a big change. But so speaking to social distancing, as Becky mentioned, it's not really something, or at least like isolation is not really something that people with Crohn's, people with ulcerative colitis, people in the IBD community are new to. I know that I spent a month in isolation plus when I was in the hospital a year prior to the pandemic when I had my surgery. So, and it was very similar to Becky in the sense that I was in isolation plus, so I was unable to, when people were coming into the room, it was often they were not hazmat suits, but they felt like hazmat suits. There are people in these full get-ups with masks, gloves, and I was in a negatively pressured room, so there was a door to get into my room, and then there's another door. It just felt very lonely, and I know that at least in my personal situation, I also signed off on my surgery alone. I did it by myself because I was 20, or I was above 18 at the time, so I was able to sign off on my surgery and all that, but I basically went into surgery and signed off on it alone. So that's something that I know that is very similar to a lot of the people in the COVID-19 pandemic right now, where a lot of people are experiencing situations where they're isolated and they're not unable to say or interact with their family, which is, I definitely sympathize and empathize in that context. And I know for me specifically, I don't have a whole bunch of treatment challenges, but the one thing that is a challenge is getting my medication that's supposed to keep me safe and healthy, safely and in a healthy manner. It seems sometimes counterintuitive, but obviously we have to get our medications or else we won't be safe or healthy. But I know that at least in Massachusetts we have drive-in pharmacies, which is something that really kind of takes down that interaction, which makes me a lot less stressed out and a lot less anxious. I know that similarly for diet and resources, I know that I'm stressed out in terms of like the ability to get the food that I need. So that's a big point of stress for me, being able to make sure that I get the food that I need. I'm not on a particularly restrictive diet. I'm only trying to stay away from certain types of meats, certain types of red meats, certain types of vegetables, stuff like that. But it is still very stressful for me to make sure that I get the foods that I need to, because I know, yeah, a lot of people are panic buying, which is scary for people. And I'm not even someone who has a particularly restrictive diet. So I definitely feel for people who have way more restrictive diets. I know I was on gluten-free for a while, and that would be really difficult to manage in this current climate. And I know, so lastly, mental health and coping. I know that, again, we said before that it doesn't make it, we have the resources, we have the coping techniques that make it a little bit easier, but it doesn't mean that it is easy for us, people with IBD, to be in an isolation type environment. And I know that a lot of the things that I gained when I was isolated before is coping skills. So for me, I know that I talked to a lot of nurses. I talked to people whenever I could, and any way I could. I would talk to people over FaceTime. I played card games. I tried to do art, tried to paint, tried to draw. I'm able to, currently in my living situation, I'm currently able to, obviously I couldn't at the hospital, but I'm able to play around with music. I have a guitar here that I'm learning to play, and that's something that's been really awesome. And I think finally, my last point is something that we touched on briefly before, but physical distance doesn't mean social distancing, even though obviously the phrase is social distancing or social isolation. We need to make sure that even though we are physically not together, that we take advantage of all the wonderful resources that we have. For instance, we're using right now Zoom, Skype, FaceTime, all these. There's an app that was just recently released called House Party, which is a fun social media app where we can interact with people. I think it's groups up to 8 people, and you can talk with them and play games with them. So just make sure that we remember that physical distance does not mean social distance. We need to still support people, all the people around us that we love.
Hi, my name is Chloe. I was diagnosed with ulcerative colitis at age 13, and my center is the C.S. Mott Children's Hospital in Ann Arbor. So since the pandemic happened, I am not currently, I just kind of started schooling. So since I just started, fortunately, I didn't have a huge setback with anything, but I still do feel for all the seniors and the graduating class of 2020, because it is, really devastating to be able to miss out on, graduation, prom, and things like that. Regarding, I'm sorry about my cat again. So about social distancing, I would say that, kind of how you can't, it's kind of what Becky and Quint were touching on. Just because some patients with IBD have experienced it before, it doesn't mean that it's any easier for us. I've definitely had periods of time where I have had, social distancing, or, have only been able to be around 1 or 2 people at a time when I was staying in the hospital. And, it's definitely, it's hard even when there isn't a pandemic going on. So I would say it's, definitely just a huge adjustment for everybody, but there are, lots of things that you can do to make it better for yourself. But, as someone who is has an autoimmune disease at like the higher in the higher risk group, I do think that, just abiding by the rules and guidelines of like your state, or just personally, like even waiting a little bit, like if we got off like lockdown tomorrow, I'd still want to wait a little bit just to be sure that I myself was safe. As far as treatment challenges and dieting, personally for me, I have my dad brings me all of my medication, which I'm really thankful for, because my the pharmacy that I use is by his house, and whenever I'm out of anything, I call it and fill it, and he just drops it off for me. So in that regard, I think that has made this a lot easier for me. And as far as dieting and things go, I'm at the moment currently am not on any current like diet. But I will say that, just having like the people like panic buying and food hoarding, it does make it hard because I do rather than being on a specific diet right now, what I've been having to do is eat like smaller things throughout the day rather than meals, because that's what works easiest for me right now. And with like all the food shortages, I've kind of had to like make like a certain schedule for myself. It does. I have a friend who works at a grocery store, and having him be an essential worker, he is able to bring me some things, but we do it in like a safe way. So I'm really thankful that I have people who are looking out for me during this time. Lastly, regarding mental health and coping, I would say that, pandemic or no pandemic, being isolated from family and friends definitely does take a toll on your mental health, even though we have, things like Skype, Zoom, and FaceTime. Seeing your loved ones through a screen definitely is not the same as having that face-to-face time together. So it definitely does take a toll on you, but as long just having like a group, like a support group, and people who check up on you daily, I think even though you can't see them face to face, definitely makes the social distancing aspect of this a whole lot easier.
Awesome, thank you. That was really great, Quint and Chloe, which you said. You guys made a lot of awesome points. On the next slide, we have a few questions that we've been hearing a lot recently. So I was just thinking that we could kind of touch on those from the patient perspective. I think in the interest of time, we should probably only do one or two. But Chloe and Quint, do you guys want to talk at all about either of these?
I guess, kind of what I said before, being a patient with IBD, there's definitely been a lot of times where you need to be isolated and where, being alone is kind of part of your everyday routine. And I would think that already having that experience with this, like I said, it doesn't make it easier, but it definitely has made it, as if I were, perfectly healthy, I think it would have hit me a lot harder. So I think that already having some sort of experience with only being able to be around a select few people, not being able to see my loved ones all the time, has definitely helped me kind of cope with the pandemic. And stress-wise, like as an IBD patient, we get we're involved in a lot of stressful situations and a lot of situations that can negatively impact our mental health. And this is kind of something that has impacted everybody in one way, shape, or form. And I think that without, just the experience of being an IBD patient, it wouldn't be as easy to handle. So although like it's not something I want to wish on anybody, I am grateful that I have kind of had that experience with everything, because it doesn't hit me as hard. So I think that's kind of what has helped me through this as far as since this started.
Awesome, thank you. Quint, do you want to take number two?
Yeah. So I think that I will be talking to like kind of both of the questions a little bit, like, because there's something really important that I want to talk to, but I know for resources and information, there are a lot of, I'm getting a lot of emails from a lot of people about like Zoom calls where there are support groups, and that like there are like college support groups and pediatric support groups that are all taking place on Zoom. So I think it's really important that patients who are maybe like recently diagnosed, or just any patients in general, have that ability to access these groups that often make us feel a sense of community, especially in times that if you're not able to go out and talk to people, it might be especially hard to feel connected with other people's and their experience. And just like briefly touching upon something else that kind of Chloe was talking about, but it's really important for us to, in stressful situations, be able to focus on preventative care as opposed to interventional care. So what I mean by that is the fact that I know that for me at least, I found out some of my triggers for stress. So I know that if my environment around me is really dirty, or just like there's a lot of stuff around me, if my room isn't clean and just like neat and organized, that I start feeling really stressed, and I notice it afterwards. But it was something that I worked towards, and I tried to figure out, and I said, oh, okay, so I'm feeling stressed. I think it's because of my room. So what I'm going to do is, as opposed to maybe just throwing my dishes in the sink, I can just throw them right in the dishwasher and run a load of the dishwasher, run a load of laundry, something like that. I know it sounds pretty silly and pretty simple, but just small things like that, just doing small things for your own mental health and making sure that you're feeling good even when you're not. So having your room clean and your mental health maybe isn't doing great, it will help improve your mental health if you've already done preventative things to work towards reducing stress in the long run.
Awesome. Thank you. I think in the interest of time, we'll end there. Thank you, guys.